The next page we have is the physical exam, and as soon as you click into physical exam, the first line is the vital signs, and this will pop up on the bottom half of your screen. So anytime anything pops up, it will either be on the right side of your screen, on the bottom half of your screen. Clicking OK or cancel will get that away, and you can see all the buttons under it. But the vital signs will show all the first documented vital signs, last documented vital signs, and might show some serial vital signs depending on how many were done. But just a quick way to review vital signs when you're in the physical exam page. So clicking OK will get rid of that, and we'll go back to our full screen of all the options over here. So physical exam has all the systems over here, and a few of them will be required based on the template selection. So we're in a chest pain template, so respiratory and chest and cardiovascular are required, and then these two are always required on all charts, the initial vital signs reviewed and general. Going through these, you can document as much as you want in all these systems. There's also a basic physical exam option up here that will have all the systems other than the required ones for this template. So it'll have all the or a lot of the other systems that you could document over here. Now, this basic physical exam will have some pre-selected options that are the negatives essentially that are pre-selected, and a quick way to just document all of these physical exams. So if you want to say that all of these systems are normal and you agree with all of these lines next to these systems, then clicking on the check mark up here will check all of these systems and document all of these systems for you, letting you go into the chart and document any positives or negatives that you find otherwise. If you disagree with any of these, you can just uncheck that and then document it down here in a positive finding under that system itself. So we'll put abdominal tenderness, and then we'll say everything else is normal, and then document our respiratory and chest cardiovascular exam. So first one that's required is initial vital signs reviewed. You can say yes. General. You can select as many of these as you want. Anything above the double lines is a normal finding. Anything under it is an abnormal or positive finding. So a quick way to just select all the ones that you want. If everything is normal, just look at the ones right above, and then you can go to the next required field, which is respiratory, since all of these are essentially documented in the basic physical exam. Respiratory, you want to document a normal exam. Clicking on this check mark up here won't allow you to only select the normals. It'll select everything, including the abnormals. So if you want to say that everything is normal, the check mark's not a good way to do it. This normal button down here is how you would do that. So clicking on normal, and it unfortunately just goes to the next line, so you can't see what it selects. So go back into it to make sure you agree with everything. By the time you use this often, you'll get used to what it selects and what it doesn't select. But it selected these top four, so if you agree or you want to add on a couple other things, then you could do that and go to the next line. And cardiovascular, again, you can just say normal, or go up here and unclick something if you didn't want to check that blood pressure and pulses are equal bilaterally. And then we can say tenderness for abdominal pain. Again, so that this is a positive finding, so it'll be under the double line. So we'll say tenderness and then type in where the tenderness here, or select it from this drop-down menu. Selecting more than one will replace the other one. So if you do have to, you would have to type in the other one or type in both, so we wouldn't replace it.
And just like Nasif said earlier, back to the tenderness, for that area, you only have so many different characters to type out. So I think Dr. Goldman kind of hinted on before. If you scroll all the way down, you can just type out your abdominal examination a little bit more and just say, right upper quadrant. When distracting, like if it's a kid, when I distract the patient, I push on the right upper quadrant, the patient is giggling, versus when, they're more focused. And so you can be a little bit more detailed in your physical examination, especially for the items that really, really count. So obviously it'd be more for probably the chest and the cardiovascular portion of things. But, again, that dotted line seems to be the most important part to really honing down on that physical exam portion. Same thing for like an extremity laceration or injury. For extremities, I just do that dotted line. I just talk about neurovascular, tendon, and everything else intact otherwise in terms of that.
Add on to that, I think that's an excellent point, especially for areas that are more complicated. You know, if they're all completely negative, it's not very difficult. But for areas that you're really going to focus on and try to paint a picture, and again, anytime you're using that dotted line and entering free text, it makes your chart look very, very unique and separate than just all these click boxes. So again, if there are abnormal findings, and I think that the major ones are going to be, again, abdomen probably is a great one. Skin also, if you're trying to describe a rash and clicking 13 different boxes of, well, it's an abrasion or it's a urticarial rash with, I mean, a lot of times it's easier just to click the dotted line and write in your description of that rash and trying to find every little component that might describe that rash.
Okay. So just going through these, most of these are set up the same way with the check boxes. A couple of them are different, and I'll just touch on those. Extremities is one of those, and like Dr. Brokish said, it might be easiest to just go to that dotted line. It would be under assessment and all the way down at the bottom, and you could type in everything. The other way to document anything on extremities is on the first line, select the extremity that you want to talk about, and then on the second line up here, you choose your finding for that extremity. The thing about documenting multiple extremities, however, is that you can select as many as you want here, but these are all under the same assessment. So clicking this repeat button down here, if you have different assessments for different extremities, so we're going to talk about the elbow in this one, and then we can choose a different finding and for all the other ones or whatever you'd like to say, and this is normal inspection. So might be easier to just have that text box at the bottom and just type in whatever you'd like rather than having to select different extremities, and you can just type in your findings for those extremities, or you could find each one and just type in the assessments for each one. All right, and one other system that looks a little different. So all the way at the bottom, it'll say body, front, and back, and this will be a picture of the body if you'd like to indicate things on the body itself and annotate some findings. You select one of these shapes down here, so we can select a circle and circle an extremity or circle anything that you'd like to document about, and just say type in the finding and click OK, and that'll put a number 1 next to the circle, and we'll look at it in the clinical view, and it'll have number 1 tenderness. It'll just annotation on the narrative. It'll print out the picture of the body along with the annotation at the bottom of it indicating what the finding was. To delete one of these, if you have one, if we'd like to delete one of these boxes, so if we'd like to delete this box over here, make sure you unselect any of these shapes down here. So we're unselecting the square, just pop it back out. Anything that's clicked in will be popped in. So make sure everything is unclicked, and select the box that you'd like to delete by clicking on it, and then click delete, and that'll take it away.
So just a couple of general things I'll add on to this is, you have your two major areas, and Nasser hit on it very well. Again, you're trying to find, again, assuming you've done all the work, the easiest way to get to the information and do the exam. Your basic physical exam is a wonderful way to do it for negatives. And obviously, the areas of interest you cannot put into this examples are the respiratory system, the cardiovascular system. So the concept really is use your basic physical exam to do all your negatives, go back into the asterisk areas and add your positives. And even if they're not positives, your negatives, but specifically in those areas, if you use the basic physical exam and then the asterisk areas, you should meet the criteria for billing for a level 5 chart. Again, assuming you've done a head-to-toe physical exam on that patient. Again, a couple things to be careful about. You want to make sure that you don't say, hey, click negative, no rash, warm, dry, and then go back into the skin section and add something that contradicts what you said in one section. I have audited charts and have seen quite a few instances actually where somebody has gone in only maybe to the physical exam, come on with chest pain. They document all the asterisk areas, maybe add one more area on in, and that's it, and then they're done documenting. And that person was a chest pain who was admitted for ACS. And unfortunately, when that chart was billed out, was unable to be billed out at the appropriate level because it the complete history, the complete physical exam, which was done, was not documented. So again, make sure you utilize all the tools that you can. One, the basic physical exam, and then the asterisk area. Again, with the caveat being that those are all things that you have examined on the patient.